U.S. citizens exposed to Ebola will not be coming home, apparently. The New York Times, citing 3 people with knowledge of the plans, reports the Trump administration is sending them to Kenya for observation and treatment. It is a break from normal practice. Citizens are usually repatriated, especially when their home country can offer a higher standard of medical care. And by the way, we're equipped to do it. Back in 2014, Dr. Craig Spencer contracted Ebola while treating patients in Guinea. He was in intensive care in Bellevue Hospital right here in New York City for 19 days. Other Americans were evacuated to places like Omaha, Nebraska, and treated in specialized U.S. facilities with advanced ICU care and isolation rooms. Dr. Spencer survived, and he's now telling the Times that the U.S. is abdicating its responsibility to protect American citizens. Right now, roughly 1,000 people have been infected with Ebola in Congo, an outbreak that has killed more than 200 people in just 11 days. It is the 3rd largest outbreak right now so far on record. The Trump administration has sent 1 American doctor with symptoms to Germany and monitored 6 other Americans in Germany and the Czech Republic. The original plan was to monitor high-risk Americans in Kenya while transferring anyone who developed symptoms to Europe for treatment. But now dozens of U.S. Public Health Service officers are reportedly being trained to deploy to Kenya to provide treatment there. Here is how Secretary of State Marco Rubio explained the new policy today during a cabinet meeting at the White House.
The number 1 priority of our foreign policy is to protect the American people. We cannot and will not allow any cases of Ebola to enter the United States. So we've surged assistance to make sure that is being contained there. And obviously, multiple agencies involved here are also very involved in tracking people, just to make sure that nobody comes into this country that has Ebola and creates a problem for us.
These are American citizens, and again, we have treated them here at home before and done so successfully. MS Now senior medical analyst and critical care physician with the U.S. Air Force Reserves, Dr. Vin Gupta, says Kenya, while better than Congo, is not the U.S. He says it lacks the same level of critical care infrastructure and warned Ebola can turn rapidly and unpredictably. Quote, from a moral standpoint, he told us, we are leaving Americans behind with substandard care. We owe them better. This comes, by the way, as the U.S. has already arguably made it easier for Ebola to spread, cutting U.S. aid and the very systems designed to stop outbreaks before they get out of control, like laboratories, medical supply distribution, and disease surveillance in places like Eastern Congo. Things that could have stopped or at least mitigated this outbreak, which experts worry was spreading undetected for weeks, possibly months.